All right. Good evening, everyone. Wow, we have such a great turnout for our speaker series this evening. So I feel like that is an indication of it's going to be a great night. So I want to welcome everyone this Thursday evening, first Thursday of October, when we normally have our speaker series. We are very happy that you are joining us this evening. So good to see some familiar faces. We will give another minute for our members to hop on. So while we're waiting, I thought this was a good time just to maybe encourage all of you that are joining us to grab your friends or your family or your spouse or your partner, because we can all benefit from massage. So let's just grab everybody else that can help us and help themselves, and we'll do a little bit of learning and a little bit of demo tonight. So I feel like this is a night to get the whole household involved. So this will really be fun. Okay. Wonderful. So yeah, we've still got some members coming in. So again, as our community joins us this evening, I want to welcome everyone to our first October speaker series. Hopefully you've been hopping on with us through September as we've highlighted Ovarian Cancer Awareness Month and Hispanic Heritage Month as well. We've got really great events and topics that we covered. And of course, we're diving into Breast Cancer Awareness Month for October. So before we start, I will share my screen because, as usual, we want to give a big thanks to those that continue to support us so we can continue to bring experts like Laura that we have this evening and discussion around really important topics to our community. So I want to give a big thanks to our presenting sponsor, West Pharmaceutical, as well as additional support consistently from Daiichi Sankyo, Merck, Lilly, and GSK. They truly encourage us to keep connecting and meeting professionals and bringing them to our Unite for Her community. So we are very grateful to have them supporting. Wonderful. So my name is Erin Pellegrin. I am the Director of Culinary Nutrition and Education. Many of you I've connected with, but hopefully you've connected at least with other members of our nutrition team. Sue normally would be joining me this evening, but she is off gallivanting with her husband in Italy for their anniversary. So I said, please eat a little extra pasta for me and maybe bring me home some good olive oil and I'll teach you some self-massage. So, but she, I know, will be tapping in to watch this recording. With that being said, if you know that there are others that would benefit from a little bit of learning and a little bit of practice demo on self-massage, we are recording this evening, and our Her Speaker Series will be in our Her Library as soon as tomorrow. So feel free to share this video, come back and rewatch it, because I'm sure we're going to do a lot of learning this evening. So we will start as usual with our recording. Not with our recording, I'm sorry, our presentation. So Laura will take us through her slides. We'll have some time for questions, and then we will wrap up this evening with demo. So we will have that hands-on opportunity. And then one final reminder, again, we're going to have lots of events taking place throughout the month of October, starting with our second virtual hangout that we will be taking place next Wednesday, October 11th. So if you joined us over the summer, Cassandra Bolding, who was one of our counselors, she's on our provider list, and she is part of Black Lotus Counseling. And so she will be coming in for a part 2 segment, which she is calling Hey Sis, Are You Okay? And she'll be diving back into discussing depression and mental health in the Black community. We really just started this conversation over the summer, and we decided to bring her back just to dive a little bit deeper. So I will pop that registration link in the chat once we get started this evening. And you can view that recording again in our Her Library, as well as that second segment, again, happening next Wednesday, October 11th, 5 p.m. Eastern Time, also taking place on Zoom. So hopefully you will be able to join us next week as well. But as usual, stay in touch with us, our newsletter, our social. We'll be sharing all of the events that we have taking place throughout the month of October. So with that being said, I want to dive right in because we have great attendance tonight, which means I'm sure all of you want to learn a little bit about Laura and how we can all become experts in self-massage. So I'm going to bring her onto the screen while I share a little bit about our dear friend and partner of Unite for Her. So Laura Bryant-Earner is a licensed massage therapist. She is the service director for Healwell and a member of Healwell's curriculum development team. As the service director, Laura coordinates, supervises, and provides care for Healwell's massage programs in hospitals and communities and medical facilities. She has more than 20 years of teaching experience, both as an English teacher and a hospital-based massage instructor. She continues to work with clients experiencing cancer treatments and its side effects. Please join me in welcoming our expert this evening, Laura Bryant-Earner. Thank you so much for joining us tonight.
Thanks, Erin. I really appreciate that warm welcome. And as I was listening to the welcome, I kept wanting to turn around and say, who is she talking about? I'm
Amazing.
so excited to be here with you and with our friends from Unite for Her and with all of you that are here tonight. Thank you so much for joining us and for giving up your time this evening. I really hope that it's going to be worthwhile for you. So again, my name is Laura Bryant-Earner. My friends here at Healwell call me LBE. Please feel free to call me that. You can call me Laura, or you can call me Hey You. I will answer to anything. My background is in teaching. I was an English teacher for a long time in Japan. And when I came back to America, I fell in love with massage. So I have been a licensed massage therapist for 5 years. All 5 of those years I've been practicing oncology massage. I'm also a certified manual lymph drainage therapist. My population that I work with are folks who have lymphedema at stage 1 and stage 2. So I am so excited that you are here, and we're going to talk a little bit about some oncology massage, the benefits, and we'll dive right into some demonstrations with lots of opportunities for questions or any clarifications that need to happen tonight so that you get the most out of it. And I want to echo Erin's encouragement that if you have friends or loved ones nearby, if you want to rope them in, have them join in the massage party, I encourage you to do so. All right, let's get started. I'm going to share my screen here. The really exciting thing about massage is that not only are we caring for ourselves physically, but we're also caring for ourselves mentally as well. Right. Oh, now my slides do not want to move. So let's see what we can do here. Let me just stop that real quick.
Yeah, no worries. Technology is never as easy as we think it's going to be.
Nope. There we go. We got this. All right.
Wonderful.
Thanks, everybody. Appreciate your patience. All right. So I am assuming that everyone is here tonight because you already know that touch is so incredibly important as our experience of being human beings and living in these bodies. We know that massage feels good. And we know this. We are born instinctually knowing this. How many times have you hit your arm on a table edge or banged your knee on a coffee table edge, and you instinctually place your hand on that area and start rubbing it because it feels good? There is a biochemical response happening when touch is initiated. The really exciting thing about this is that while I am a massage therapist, and I love to hear people going out and getting a massage for themselves from somebody else, the reality is that we don't always have those opportunities for any number of reasons. And the great thing about massage is that the massage that you provide yourself, that self-care, is incredibly effective and incredibly beneficial to you. And so that's what we're going to talk about tonight. And that's what we're going to learn tonight. So some of those benefits of massage. I'm sure some of you have heard about the Big Five. So when going through a cancer diagnosis and cancer treatment, oftentimes someone might experience anxiety, depression, nausea, pain, and fatigue. In the last 20 years, we are seeing a growing body of research and evidence-based research looking at the benefits of massage. And what we are finding, there's really good growing evidence that strongly suggests that massage can do all of these amazing things. It can reduce anxiety. It can reduce depression. It can address nausea. It can alleviate pain. And this last one really surprised me and thrilled me, that it can alleviate fatigue. These all have effects on quality of life. And so it's really wonderful to be able to have another tool in your little Batman belt to be able to empower yourself and address some of these symptoms and to bring comfort for yourself. So tonight, some of our specific goals are, we will be learning massage that, as I said before, is going to really help support any symptom management that you might be looking for to improve quality of life. We're also going to look at and practice a massage protocol that's really effective at alleviating CIPN. And I know most of you know this, but in case anyone doesn't, CIPN stands for chemotherapy-induced peripheral neuropathy. And what can happen is someone who is going through cancer treatment may experience this during their treatment, or they may not have any symptoms during treatment, but 6 months down the road start to develop this subset of symptoms. And the symptoms range from tingling, burning, shooting pains, a feeling of almost like you're in a pack of mud. And it really can interrupt how you interact with the world. And what often happens is, now CIPN can occur anywhere in the body, but most commonly occurs in hands, feet, legs, arms. I have some folks I know have experienced it in their noses. So it really can show up anywhere in the body. And that is really, as we have talked about, can affect quality of life. Now, CIPN can be treated pharmacologically, but there is also a growing body of evidence that it can be alleviated with a massage. And this is something that you can do for yourself wherever you are at any time of the day. So we'll talk more about that a little bit later. We're also going to do some scar tissue work. This work is very gentle, and it can be used with any number of scars, small or larger. Scars from port removal, drain removal, lumpectomy, mastectomy. Scar tissue work is, I think, one of the most beautiful things about massage, and I'm really excited to be able to share that with you tonight. So I look forward to doing that. And save the best for last, tension. Massage is really effective at treating tension, alleviating tension. And so we will talk about some great places that you can work with yourself, or if you have somebody who is offering to massage you, they can work in these areas. So I just want to share a little bit about the history of oncology massage, and to reassure anyone who might be concerned that massage is not safe. And I'm hoping again that everyone is here tonight. Perhaps has had a good oncology massage, but what I wanted to share with you is that it used to be even as early as 20 years ago, 25 years ago, the thinking was that massage could possibly spread cancer and was not safe. That was based upon the theory that circulation, increased circulation, would spread cancer. Therefore, massage was not safe if you had a cancer diagnosis and were being treated for cancer. And as we have come to understand how cancer spreads, the process of metastasis, and how massage interacts with the body, we know now that massage is safe. And we know this if we look at the exercise principle. So this idea that circulation is increased from massage. There's a wonderful debate about this in the massage world. I won't bore you with it, but the idea that a massage increases the entire body's circulation versus a local area. And what I would encourage you to do, I invite you to do now, if you are comfortable doing this, is if you would stand up, just stand up with me, and then sit down. Make sure you hit your chair. And maybe stand up one more time. Give yourself a wiggle. And sit back down again. I will tell you with 100% certainty that you, through your movement, through contracting your muscles, have increased your entire body circulation so much more than my two little hands could ever do giving you a massage. And so this is why when people are being diagnosed and getting a treatment plan, one of the supportive services people are encouraged to do is what? Is to exercise. Because the science understands now that movement and circulation does not affect metastasis. Metastasis is fancy. It's a whole list of biochemical processes. So I want to assure everybody that the massage that you will be learning tonight is safe and it is effective, and it is a wonderful thing for you to be able to do for you tonight, for yourself tonight. Having said that, I want to bring up, if you have an infection, if you have a cut, broken skin, if you have swelling, if you have an area that is incredibly sensitive to touch, please avoid that area. We want to be safe. We want to be supportive. And you can just work around an area that may be inflamed, reddened, infected, or swollen. There's lots of things that we can do. So with regard to that, I would encourage you, before you start massaging, treat yourself to a good old hand washing session. 20 seconds. Everybody knows how to wash their hands now through having gone through the pandemic. I mean, if you want to wash your hands for 20 minutes, have at it. But 20 seconds is enough. And we just want to be safe. All right. And then finally, a word about pressure. I'm going to show a different slide now. This is the Walton pressure scale, which was created by our friend Tracy Walton, who's one of the pioneers of oncology massage. And when we're talking about pressures, what Tracy has done is created a language for everyone to speak the same language. So for example, when I go into get a massage and I tell my massage therapist, I want medium pressure. What exactly does medium pressure mean? My medium pressure may mean something wildly different to my massage therapist's idea of a medium pressure. By using a scale, we are quantifying pressure in a way that makes it easy to communicate. So tonight, what you and I will be doing, we will be massaging at a pressure 1 and a pressure 2. Now let's practice together. We'll walk through it together. A pressure 1. Pressure 1 is equivalent to light lotioning. So imagine you have some lotion on your hand and you're going to spread it on your arm. It is a light touch. It is a full touch. You are contacting, you're using every surface of your hand to contact your arm. It should not feel tickly or drippy or icky. Nobody wants that. This should feel good, just as if you were spreading lotion on your skin. That is a pressure 1. A pressure 2 is if you imagine you are now rubbing that lotion in to your skin. So the difference you can see in the picture from pressure 1 to pressure 2, a pressure 1, when you are moving across the skin, there's no movement of your skin. There's no movement of the adipose tissue or muscle. There is no shadow between, there's no dimpling between the hands and the skin that you're touching. With a pressure 2, a little bit more pressure, again, that heavy lotioning feel, you are moving the top layer of tissue. You are affecting that superficial layer, adipose tissue, and maybe a little bit of muscle. And as you can see in the picture on the screen, there is movement, there is dimpling as the hand moves over a body, moves over skin. So I just want to take a moment and ask everybody to give themselves a nice 10 seconds of pressure 1 massage right on their arm. And just get comfortable with that idea of a pressure 1. When you're ready, you can move to a pressure 2, which is that heavy lotioning. And you're moving. You can see my hand is moving my skin on my arm. That's a pressure 2. What I would encourage you to think about with pressures 1 and pressures 2, they may be a little bit lighter than what you historically have received in the past. That's not uncommon. The exciting thing that I want to tell you about this amazing body of research that we've been gathering over the years is there is really strong evidence to suggest that pressures 1 and pressure 2 are more effective for alleviation of pain and anxiety than pressures 3, 4, and 5. And pressure 1 is even better than pressure 2. I know everybody's mind was like, what? No, yes, it is. So this kind of massage is incredibly safe, incredibly supportive, and it feels good. So I encourage you to play around with these pressures, have fun. And again, this is really about self-care. All right, so tonight, as I referenced before, we will be learning our chemo-induced peripheral neuropathy protocol. We're also going to learn a beautiful head, ear, neck, and shoulder massage. And I will do my darndest not to fall asleep on y'all. Okay. Yes, it's wonderful. It's just beautiful what you can do for yourself. I hope you get excited about it. We're also going to look at some acupressure points. Acupressure can be very beneficial for some of that symptom management that we talked about earlier, specifically pain, nausea, and fatigue. We're also going to do some scar work. So again, scar work can be used with any type of scar. A scar that is as fresh as 4 weeks up to being years old. I hope you're excited. I'm getting excited. I'm excited to be here. I'm excited to share this with you. It's really great work. All right. Now, I want to encourage you to get comfortable, because as our friend here, Floyd the Frog, says, we're going to rub it. We are going to practice massage tonight. I encourage you to find a comfortable position. I encourage you to be creative with your positioning. So if you're sitting in a chair, I encourage you to make sure that your sits bones are perfectly balanced. That if your feet are on the ground, that they're both firmly on the ground. Perhaps put a pillow behind your back to support yourself. If you're in a recliner or your bed or the sofa in more of a reclining position, you could pop a pillow underneath your knees, behind your back. You can use some rolled up towels. Anywhere that you feel like you might need support, this is going to encourage your body to relax even more deeply. All of these massage techniques and protocols can be done without lotion. And I would encourage you, just for tonight at least, try all of these techniques without lotion. See how it feels. Specifically for the scar work, I'm going to ask that everyone, just especially for tonight, definitely stay away from using lotion, because we want to be able to really feel and see what we're doing. There is no any specific kind of lotion that would be required. I would encourage you to use what you like, because again, this is about comfort and self-care. And if special lotion made from the moons of Saturn or Jupiter and sprinkled with fairy dust is what gets you excited, then go for it. Again, this is about you and supporting you. All right. I think that is enough talking head for now. What I would like to do is open this back up to question and answer time. If there's anything that you would like me to clarify or go over again, please raise your hand. I'd love to hear from you.
Oh, Laura, I see you're raising your hand. Yeah, go for it.
Hi, Laura. Great name.
Hello. I know, it's a great name. It's the best one. I'm sorry you caught me with a bite of dinner, but I do have a question.
Please.
And I wanted to say thank you for being here, and my thoughts are with everybody as we learn to take care of ourselves. And I'm about 5 weeks post-op, and I wanted to know if there's any time that's too early to do this kind of work.
That's a great question, Laura. Thank you so much for asking. The caution that I would suggest to everybody is just for 5 weeks looking at scar tissue work. And we'll talk a little bit more about the timing. Scar tissue work can happen as early as 3 to 4 weeks, actually even 2 weeks if the scar is closed. But the point that I'd like to make with that is that we will be working in the areas on the periphery of the scar, not with the scar itself. A little bit further down the road, after the incision is fully closed and there is some stronger tissue, we can then start incorporating scar work on top, right on top of that scar. That's a great question, Laura. Thank you so much.
Thank you. Mhm.
Okay. I don't see any other questions, but like I said, feel free to put them in the chat as Laura takes us through her demo. Laura, I'm happy to interject if I see something or puts, someone put something in the chat for you.
Great, Erin. Thank you so much. I appreciate that. Oh, Patricia. Wonderful. Oh, yes, the pre-study inquiry. Great. Yes, yes. Well, part of the materials that Erin has and that will be provided, I believe, and will be available, accessible to you by tomorrow, is going to be this CIPN protocol that we're going to do. And so, of course, if you have any questions as we go along, please feel free to raise your hand, literally or figuratively, and we will step back and take a look at everything. And also, if you have any questions after this presentation, you can get in touch with me and be happy to talk further with you. Okay. All right. So let's, Patricia, you read my mind. That was a beautiful segue. Thank you. Thank you. Thank you. We are going to start with the CIPN protocol. All right. So tonight we're going to work with hands, just because I couldn't figure out a way to get my feet up here and massage and show you. And I just figured it would be embarrassing for you and for me. So tonight we're going to work with our hands, but this is equally applicable to working with massaging your feet and your legs. If you are going to massage your feet and legs yourself, again, I want to encourage you to get creative about being comfortable and bolstering yourself. So it may be that you need to use a few pillows to help prop your leg up. If you have difficulty bending your knee a little bit, I would suggest placing a small rolled up towel underneath your knee to support yourself. And then again, if you have the opportunity to invite a family member or a loved one to learn this protocol and provide it for you, it's really, it's equally pleasurable for them as for yourself. Again, going back to massage feels good. We all know this instinctually. And one of the things that massage does is release the hormone oxytocin. And giving ourselves a massage or receiving a massage from someone else releases oxytocin. Okay. All right. So having said all that, let's massage. Get my hand up here so that you can see it. For somebody experiencing CIPN, it may be that their symptoms are more concentrated in a portion of their hand, right? So for tonight's purposes, I'm going to say that the CIPN symptoms, the burning, the possibly the pins and needles feeling, shooting pain, or just kind of a numbness, maybe extend a little bit past my knuckles. Okay. What this means is that to begin with, we're going to warm up our tissue. And we're going to be working from the tips of the fingers all the way up to your elbow. So in order to warm up, I'll ask everybody to rub your hands together, warm up your hands. It just feels better. There's no magic about this whatsoever. All right. When your hands are nice and warm, just gently place one hand, starting with the tips of your fingers, on all surfaces of your hand, top, bottom, side to side, and just give a gentle squeeze to warm up the tissues. We're going to always work from the fingertips towards our elbow, or if you think about it, you're working towards your heart. When you've worked your way up to your elbow, maybe just one more warm up. of a gentle compression, moving your way up towards your elbow. Once you've done that, again, starting at the tip of your fingers, we're going to do a sweeping glide. And here we're really just sticking with that nice pressure one. Feels good. Light lotioning. Warming up the tissue. All right, and I'm trying to move my hand up and down just so that you can see the entirety, the breadth of the work that we're doing. Once you've warmed up your tissue, starting at the tip of your thumb, you're going to use your other hand. You can either use a thumb or a finger, whichever one is more comfortable for you. And I would recommend, as opposed to using the tip of your finger, which is pointier and less contact surface, I encourage you to use the pad of your finger. There's more contact surface, feels better. Starting at the tip of your finger, you're thinking about quartering an orange. You're going to do short 1-inch strokes. Starting at the tip of the finger, a short 1-inch stroke down. Let's come over here, down. You can go over your nail bed. Again, remember that if this is an area of your body that has been affected in any way, if it's painful, if it's broken, if it's infected, just massage around it. You do not have to massage that area for this to be effective. Okay? All 4 sides. And as you get comfortable using one finger to do this, 1-inch stroke, always towards the heart, all the way down to where your finger meets your hand. That's where we're going to stop. That's the border that we'll stop at. You can use one finger, as I was demonstrating. You can also use 2 fingers. And just, again, starting at the tip, 1-inch stroke. Now, I don't want to confuse anybody, but if the stroke down is a little too confusing, you can think about pushing. So more of a pushing motion or a rocking motion, if that is more comfortable for you. I had one teacher that taught me the stroke down. I had one teacher that taught me the push. And just for my own personal preference, I prefer the stroke. All right. And you can use 2 fingers all the way down. Now, these strokes, after you have warmed up, are just a little bit, we're at that pressure 2 now. But be aware that if your skin starts to change color a little bit, back off on the pressure. That'll be your warning sign that maybe just a little bit of backing off. Okay. So now we have massaged our thumb. We're going to move on to our index finger. We're going to do the same thing starting at the tip. 1-inch stroke down. 1-inch stroke down. Working our way down to the base of the finger. I want to be careful how I present this middle finger. I have a very bad habit of not thinking about that after having lived out of America for so long, for 20 years. So I made myself a note tonight. All right. Working your way down. And you want to make sure that you are massaging all 4 sides of your fingers. Moving on to the pinky finger. all the way down. Okay. Once you have massaged all 5 of your fingers, all of the fingers that you got to your hand, we're going to move to the back of the hand, the palm, and the sides. Now, in this area that is a broader surface to work with, I encourage you to use the entirety of the flat of your finger. You can even use some 2 fingers. And again, you're just going to continue this 1-inch stroke, working your way towards your heart. Yep, I see a bunch of you doing that. That's perfect. Yep, lovely. Working your way to the wrist. And working on the sides all the way to the wrist. And then the palm, again, you can use 2 fingers, 1 finger. And you can see that my skin is moving just a little bit. Don't need a lot of pressure for this to be effective. You can stay at a pressure 1 or pressure 2. All the way down to your wrist. The point that I made earlier about a hypothetical, if somebody were to have symptoms that were mainly focused in this part of the hand, I would want to spend another session starting from the tips of the fingers, working my way down again to give this whole section some extra love and encouragement and massage. Okay. We've massaged all the way down to the wrist. And now at this point, because again, you've got this broader surface, you can use more fingers, or you can stick with that thumb or 2 fingers, whatever is comfortable for you. You can take the strokes, and these can be a little bit longer. They can now be 2 inches. Again, a pressure 1, a pressure 2, working your way down from the wrist up to your heart. All of your strokes go up to the heart. You can use your whole hand all the way up to your elbow. Okay. Once you have massaged all the way up to your elbow, that's a good time to finish. So as a finishing stroke, again, going back to that pressure 1, that light lotioning, start at the tips of your fingers and a nice sweeping glide up towards your heart, covering all of the surfaces. You don't want to leave any surface unmassaged. Once you get the hang of this protocol, depending on how comfortable you feel with it, how much of the area that you might want to spend extra time on, it may take you anywhere from 5 to 10 minutes per hand. Okay. Just take your time with it, enjoy it. It feels really good. It feels really incredibly good for your nervous system, and it's very calming. Okay. And again, this is one of the techniques that you can use with or without lotion. It is really your preference, whatever you enjoy. Okay, I'm going to stop talking, give everyone a chance to ask any questions they might have, or if you need to review anything. Why don't we do that now?
I have a question. So for those that might want to address their feet or lower limbs for the CIPN, following the same sort of techniques, individual toes, sort of moving to the pad of the foot and then to the heel and up. So we're following sort of the same segments.
Yes, and thank you for bringing that up, Erin. That's a great point that I want to make, is that with the structure of the foot and the heel, as you do the pad of the foot all the way up to your heel. And then you want to make sure that you're including the sides of your ankles, of that ankle. So that, again, you're not leaving any area untouched, unmassaged. And again, working your way up towards your knee and a little bit beyond your knee. So the equivalent of tips of fingers, tips of toes, tops of the hand, tops of the foot, sides, all the way up your calf, up over your knee. All right. Again, resources will be available. There is a PDF provided for you. You can help you walk you through it. And if you have any questions, you can reach out to Healwell at info@healwell.org. I will say that there is good research talking about the efficacy of massage for CIPN symptoms. Each of those research projects that looked a little bit different, the protocols were a little bit different. This is the protocol that Healwell uses in all of our cancer massage programs. And what we have heard from people is that as they continue to do this protocol, which can be done every day, and we encourage you to do it every day. I mean, this is something that you can do while you are sitting and zoning out to Netflix or whatever it is that you like to watch. That people have experienced a regression of their symptoms. So, for example, if they started with just a little bit of tingling and then progressed to burning sensation, pain, and then numbness, they may experience those symptoms regressing back through to the original symptom. If you experience that, that is not uncommon. I hope it doesn't happen, but I would encourage you, if you are in chemotherapy treatment, to incorporate this into your just daily routine. If you are out of treatment, this also is very effective. And what I will say is that during chemotherapy treatment, you are continuing to receive chemotherapy. You may experience, and hopefully will experience, some relief as you do this treatment, and then you will get another chemotherapy treatment. And so you may experience, it will be an ongoing process. For people who are finished chemotherapy treatment and are doing this massage, anecdotally, that is where we see the longer lasting effects. All right, let's move on to the delicious head, neck, ear, shoulder massage. Okay. All right. What I'm going to ask you to do is we're going to start with, I'm going to move my camera down just a little bit here. This area right here above your collarbone. Okay. There is where our lymphatic system dumps back into our cardiovascular system. All right. This is a wonderful place to begin a head, neck, and shoulder massage. It is a very light touch. It's more of a skin stretch. You are going to start with one hand and place it just above your collarbone in that little divot. And you're going to gently pulse your skin towards the midline of your body. Now, if you have a port, this might be uncomfortable. I would recommend that you not do this on the side that you do have your port. Okay. You can pulse anywhere from 10 to 15 times. If you're feeling super coordinated, you can use 2 hands, cross over like a butterfly. And again, just bringing those little pulses towards the midline of your body. So some people find it easier just using 1 hand at a time, and some people enjoy using 2. You should not feel any pressure. You should not feel any lightheadedness. Okay. After you've done that a good 10 to 15 times, we're going to move our way up the neck. We're going to take our little circles in a downward motion, just very gently, stimulating the cervical lymph nodes, the lightest pressure, and just some nice circular downward circles as you work your way up your neck. Once you reach your ears, for those Trekkies out there, I see you. We're going to do the Spock fingers. If this is something that you cannot do it like this or do it like this. What we're doing is we're creating a pocket for our ears to sit in. So whichever is more comfortable for you. All right. We're going to massage the areas around our ears, again, in those circular downward motion. And this is a good time to just check in with your body, make sure you're comfortable, make sure that your arms and your shoulders are not stressed out, they aren't tight, because the last thing you want to do is give yourself a massage and feel worse than when you started. If you want, close your eyes, take a deep, slow breath in, and release. All right, moving on, we're going to massage the base of our skull. What I want you to do is have your 2 middle fingers meet up the back of your head, base of the skull. Okay. Now, along that ridge that you can feel at the base of your skull, using those flat pads of your fingers, the fingertips are going to be too painful. Using the flat pads, starting in the middle, just some gentle circles along that ridge, working your way out in this direction towards your ears. Starting in the middle, you can cup your head, circles. Okay. Going back to your neck, a little bit below that ridge. This time, I don't want you to bring your fingers together. I want you to leave a little space for your spine. And just continue those circles and bring them down your neck to where your neck meets your shoulders. For anyone who has a dog or a cat or likes to watch the Nature Channel, you'll recognize and appreciate this next move. So have you ever seen a mama dog or a mama cat pick up their little one by the scruff of their neck? And there's all that wonderful loose skin back there and just picks them right up. That's what you're going to do here. So I want you to take your hand in this shape, cup that back of your neck, and just do a gentle squeeze. You should just feel that top layer of your neck release. You can just do that along your neck, working from the top down to the base of your neck. And then we're going to continue that into the shoulders. So coming across the body, with this cupping motion with your hand, a gentle squeeze to your trapezius muscle. As you hold that meaty part of your shoulder, I want you to gently, if it's comfortable, just take your ear towards your shoulder, away from the hand that's holding your shoulder. So leaning away from the hand that's holding the shoulder. Gently come up as you continue to hold that part of your shoulder. Look to your left. Look to your right. Come back to center. You can do the same with the other side. Okay. I think for time's sake, we won't include that in this demonstration, but that is, again, holding that meaty part of your shoulder. Just give yourself a little bit of motion, and you may notice a difference already between the two sides. I do. Erin's shaking her head, yes. All right. And you can just work your way back up. You can start at the beginning, again, working your way up your neck. A little bit of Spock ears. And then we're going to go into our head and our ears. Now, for some folks, ears are not where it's at. And so I just want to encourage you to stand by that. If you are somebody who enjoys a little bit of ear work, what we're going to do is we're going to pinch at the top and just do some little rubbing circles. You can see that I'm pulling my ear away because it's happy to see you. It's waving at you. All right, we're going to just pull that ear away a little bit and do those rubbing circles all along the edge of your ear. Take as much time. And when you get down to about the earlobe area, if you want to switch your hand so that it's easier, I recommend doing that. Spend as much time here with your ears as you like. You can even take index fingers and back into this part of your ear. Move your ear around. Once your ears and that area around the ears has relaxed, let's move into a scalp massage. There are two different techniques for scalp massage. Earlier, we talked about the difference between using the tips of your fingers and the pads of your fingers. If you use the tips of your fingers, it's going to feel more like like you're having your scalp washed, and there will be kind of a scritchy noise. Some people really enjoy that. It's whatever your preference is. So you can incorporate that into the massage. There will be less movement of your scalp with that surface rubbing like this. When you switch the pads of your fingers, you're going to see more movement of your scalp. That fascia is going to move. And you can see I'm moving my eyebrows because of the circles I'm doing with my scalp. All over your head, you can see my forehead is moving and grooving here. I promise I won't look at you. Just make as many, funny faces as you want. It just feels so good. And what is really interesting about the connection with our shoulders and our head massage, if you've ever seen some diagrams, pictures of the fascial sheet, of the connective sheet of tissue that starts here and goes all the way down, covers our scalp, goes down the back of our necks and into our shoulders. That is all connected. And we can hold a lot of tension in our heads without realizing it. Okay. All right. I want to move on to a very quick facial massage where where people can hold a lot of tension, which is in this TMJ, which is our temporomandibular joint. And how you find that is right in front of your ears, that little divot. If you have trouble finding it, I want you to open your mouth and feel that joint move. And you'll feel the joint kind of pop. Okay, that's the TMJ. Sherry makes a wonderful point. Head massage feels good on a bald head. Yes, it does. But again, it is a personal preference. Some folks may have a lot of sensitivity in that area, and other folks are all about asking for a 50-minute head massage, scalp massage. It is absolutely your preference. So some circles in that temporomandibular joint. And then I want you to take your fingertips and just tuck them in right underneath your cheekbones. Deborah Lee asked a question of, does it stimulate hair growth, a scalp massage? That's a great question. There is some debate about that. The theory being that you would be increasing local circulation, which could help hair growth. I have not seen any statistical analysis of that. Again, it goes back to your personal preference. I have heard anecdotally that it can help. Okay. After you're done massaging under your cheekbones, I want you to drop your jaw and just slowly bring your fingers down. There's a big muscle, the masseter muscle. It's one of our chewing muscles. And just allow your fingers to sink into that muscle and release. Once you come down to the corner of your jaw, a couple of circles here. Pinch your jaw. And I'm just going to take my glasses off to show you. At this point, I want you to clap, create some friction, heat, and slowly, carefully put your palms over your eyes and just cup your eye sockets. Allow the warmth of your hands to soak into those orbital muscles. And when you're ready, just gently release. Maybe do a little bit of a wiggle if you want. All right. Is everybody still with me? No one's snoring? If you are, I mean, it's okay. I mean, everybody, I'm sitting here watching everybody. Y'all look great. Thank you. You all look so beautiful. Great question from Patricia. The only time it really matters which direction the circles are is as you're going up your neck. You just want to keep those circles kind of coming down. That's really the only time you need to worry about the direction of the circles.
Does it matter whether you're making a circle back towards or forward? Okay.
No. Yeah. Whichever is more comfortable for you. Yep. Thank you. That's a great question. All right. Erin, are we okay on time? Could we go a little bit longer? Do we need to wrap up soon?
I think we can go a little bit longer, and certainly for those that have to hop off, we're so glad that you joined us. But yeah, we will continue recording. So join us again tomorrow to catch the end of the session. But Laura, I'm here with you. I'm excited.
All right. Well, if anybody does have to go off, I do want to just say a personal thank you so much for being here tonight. And I hope you will come back and just join us later when you can. Okay. For those of you who can stay, we're going to move on to some pressure points on the body. that can affect positively fatigue, nausea, and pain. And the really nice thing is that some of these pressure points are the exact same thing for all of these symptoms. So very economical. All right, so the first one that we're going to look at now, and I'm going to give this caveat again, avoid an area that is swollen, that is red, it has broken skin, or if you have lymphedema in an area, I would say just avoid that. Okay. All right. So for fatigue and anxiety, there is a point on the wrist called T1. Excuse me, got myself mixed up. Between our eyebrows is the T1 area. And so just using your index finger, finding the spot right between the eyebrow ridges, not the base of the nose, but the eyebrow ridges. You just want to do some circles. Again, pressure 1, pressure 2. Within your comfort level, you don't have to press hard. And it does not matter which direction the circles go. Okay. All of these pressure points can be massaged in circles for 3 minutes each. With consistent practice doing this every day, there has been some really good research showing an improvement in fatigue for a short-term effect, anywhere from 17% up to 70% for fatigue and anxiety. Okay. So here is just that one little point on your face. Okay. The next one for fatigue is our heart 7 point. This is going to be on your wrist in this little divot that is in line with your pinky finger, right at the wrist crease. You should feel it. Again, I recommend using the flat of your thumb, or if that's not comfortable, a different finger. And again, circles for 3 minutes. Our next one for fatigue is found at the top of the head. So thank you, Laura. So the midline of your face, pretend your face has been cut in half here, and then halfway between your ears. You're going to take both index fingers or your middle finger, and again, circles for 3 minutes. The last place for fatigue, and it's also a place for pain, and this is a well-known pain pressure point, is in the webbing of your hand and thumb. And in this meaty part, you can feel that big muscle, and right there at the top of it is where you're going to apply pressure and circles. Again, all of these points, massage for 3 minutes. Daily practice will see consistent results. Okay. For nausea, we're going to do the famous P6 spot. So this one is going to be on our wrist. And if you are on it, so for example, my right hand is my dominant hand. So that's how I'm going to demonstrate it. It can be done either or, and it's recommended for both hands. Okay. You're going to take your 3 middle fingers and place them under your wrist. Once you have your 3 fingers placed, take your thumb and place it right underneath your index finger. That's the spot. Now, most human beings have 2 tendons that run down. Sometimes some people have 1, because human beings are wonderfully fascinating, okay? But in this area, you should feel a little valley between the tendons. You're going to apply pressure, circles, and you may feel an achiness deep in your wrist. Once that's been achieved, you can stop. This is, if you've heard of the C bands for folks who have seasickness, this is the pressure point that that's addressing, that is working with. Okay. One hand for 2 to 3 minutes, and then you can switch to the other side. That's going to be it for the acupressure. Before we move on to scar tissue, are there any questions, or does anybody need a refinement or a review? Speak now, or forever hold your peace.
I think everyone is just quietly calm and relaxed.
Wonderful. All right, and very quickly, let's just look at some easy, gentle scar work. So Laura had that great question about when to begin scar tissue work. So the thing to remember about scar tissues is there's really 4 stages of wound healing. The first one is when you have that initial injury and your body immediately goes into defend mode and immediately creates a plug and stops the bleeding. That's instantaneous. The second wound stage is inflammation, which is more defensive. And you've seen that redness. That's your immune system kicking in and doing its job. Stage 3 and stage 4 is when your body does this amazing thing of laying down collagen and all of the tissue to draw that incision back together, and then to create fibers to hold that together. So in stage 3, which is anywhere from 4 to 24 days, you can do scar tissue work, just not directly on the incision itself. So what you can do is work around the scar, the incision. So what I've done is I have created a little demarcation line for myself. So if a scar was within that stage 3, where it is, you see some tissue, but it is very fragile. We don't want to disturb that. But working about 2 inches away, you're going to practice your C's and your J's. And you might say, well, Laura, what the hey ho are C's and J's? I'm so glad you asked. You are going to make the shape of the letter C or the letter J using the flat of a finger, that flat pad. Now, this is where it's important not to use lotion, because we have these little gecko pads on our fingers that help us grip skin. And when you're doing scar tissue work, you don't really want to slide off, because with scar tissue work, what's important is the stretch of the skin. So you would make the letter C, and I'm doing my C's backwards. Either direction is okay. But you can see that this is moving. Even though I am not touching it, I'm working 2.5 inches, 2 inches away. You can do your C's, or you can do a J, which is essentially a hook. You would just take it down and then hook. And again, you can see the movement happening at the site of the injury. You don't need to work deeply or for a long amount of time with a scar tissue work. With a scar, 5 minutes is plenty. Okay. And being consistent with it again is key, is when you're going to see some really great results. Now, once you have moved out of that stage 3, which again could be, up to 24 days, 21, 24 days, you have some more stable tissue. And you see that classic kind of red raised scar. This also is effective for scars that are years out. Yes, that's a great, Erin, thank you. So above and below. So again, just that periphery of the scar is that what you would address using your C's and your J's. Okay. Once your scar is strong enough to be worked with directly, there's a couple of beautiful scar techniques that we'll just go over right now. Okay. The easiest one is the top and bottom. So using some fingers, your little gecko pads, you're going to push towards the scar, towards the incision. And you can see my line here is moving. There's movement. You're going to push in towards the scar and hold it for a couple of seconds so that there is tension. Release, move along the length of the scar, and again, pushing towards the scar. All along the length. And then from the top, you'll do the same. Using the flats of your fingers, you'll push towards. Now, it's easier if you're holding, depending on your situation, depending on where your scars are, just angle your opposing hand so that it's comfortable for you. But again, you're going to gently stretch that skin towards the scar. What you can get on the scar itself, and then back and forth, back and forth. Again, this up and down motion, stretching that skin. Tension is the name of the game with scars. It used to be that scars were broken up and vigorously worked with. Thankfully, we have learned a lot, and the science has really come a long way in helping us understand scar tissue. There is a biochemical change, a histological change within the cells in scar tissue when there is tension applied to the tissue. So stretching and tensioning the scar is the name of the game. And again, you can just kind of rock back and forth, and you want to see that tissue move under tension. A different way to tension a scar is to crimp it. So I love to make pies. I crimp it and then I shear it and I crimp it. And when I work with scars, I'm thinking about making pies. What you want to do is you just want to pinch so that there is tension in a different direction. The scar tissue is being pushed up. So you can crimp all along the scar. And then to finish off, you can crimp, and then using your finger, using your thumb, you're going to push. So crimp, and almost like you're trying to twist it, twist a dial, so that you are creating different angles of tension on that scar tissue. Again, consistency, being careful, being aware of a scar, how close you are to a surgery. Less is more. If you work for a very long time with scar tissue, it can create more scar tissue in that it becomes irritated. And that's not what we're after. We're looking for a softening, an opening up of that space so that you are getting more movement, less pain, and that the scars just lie down beautifully. All of those scar tissue fibers line up in an organized manner. Scar tissue is one of those modalities where scar tissue work is very gentle, but very powerful. You're having a really positive effect on your body. All right. I have thrown so much at you all. I'm going to stop there. I want to thank every single person who has given up their time this evening to join us. And I am available for questions if we want to do that, Erin.
Sure, we can take one or two questions, and then I did pop your email for that info@healwell.org, that everyone is welcome to reach out. And then again, we'll have those resources available with the recording. So if anyone has any final questions before we wrap up, I think they're just sending so much love. I've got some private messages of people just saying how incredibly helpful and how amazing this session is. Great.
I have a question.
Yes, please.
On the scar tissue, I missed part of it because my daughter called. But I had my mastectomy 3 years ago, and I still sometimes feel like, because they did, the implants or the expanders right afterwards, they did the stitching right under my breasts, or right under where the breast would be. And I still feel a lot of times like I'm wearing a bra.
Yes.
And so is it good to just massage it there?
Absolutely.
Okay.
Absolutely. Again, this is, some people will recommend using vitamin E oil on. And in this case, if that helps you feel a little bit more comfortable, do ahead. But I really recommend using your bare skin so that you're able to really create a good amount of tension for that scar tissue work. I will say that I have worked with some clients who are 3, 4, 5 years post mastectomy, and there is a softening of the scar tissue, and some folks get a little bit more feeling back. The sensations change because, again, with creating that softening and allowing more space, sometimes nerves that may be compressed, scar tissue that maybe is attached to bone and to muscle is softened, and that can really open up and allow more movement and greater sensation change, so that you're not feeling that constriction that you're describing.
Thank you.
Thank you, Sherry. I appreciate it. Yes, Grace.
You're on mute.
Thank you. Good evening, and thank you so much. Sorry for coming in late. There's traffic everywhere tonight. But I had a question. So I had my double mastectomy 8 months ago. And is it okay should I do the massage all the way into the pinching, crimping? And oh my God, just the thought of that is making me cringe.
No. That you bring up a great point, Grace. Thank you so much. So this is within
I have goosebumps as we're talking.
No. So what I would suggest, Grace, is lay some loving hands in that area. That's where you want to start. Allow yourself to accept what is going on in that area just right now. When you are ready, perhaps introduce another scar technique. When you are ready, add a second one. This is at your own pace. You are in charge. This is hopefully will be enjoyable for you, that it will feel good. It won't just make you feel good later down the road. It feels good now. That is a really important part of self-care, is enjoyment. And I thank you so much, Grace, for sharing that and asking that question.
In the beginning, because you're kind of in limbo, it's your whole world just kind of goes right, flashes by you. And I remember, other scars before that with using a feather to try to desensitize it. So I was trying to put all my things into play with my scar. And then I did Mederma for, I think I probably did it for the first 3 months. So that really made a big difference with the sensation. I think, but as my days go on, I find myself concaving, and that's what makes it tight. So I'm constantly working on my posture.
Right.
But I was worried about I would do all 3 things at once, like,
And Grace brings up a great point of it is very natural for us. Our bodies want to guard what has been injured, whether that injury is a planned surgery or not. Our bodies react in the same way of, I'm now guarding. And so you may feel that the contraction within your muscles, within your fascia, within your posture. And again, I would just invite you to do what feels comfortable to you.
Thank you.
A little bit of scar tissue work goes a long way.
Yeah, thank you so much. I appreciate it. And we really appreciate all the information tonight. Thank you. This is my first time thinking, you know what, you should really get some information here, kid. It's like, I think the difference is that because I had a double mastectomy and I didn't have to have chemo, so I kind of thought to myself, like, I wasn't really worthy of going anywhere because everybody else is sick, and here's me just boobless. You know what I mean? So this is my first time. I'm like, I should really start thinking, because it rocks your world. I was very strong in my arms, and now it's like, to pick something up, I'm like, no, something's wrong here. My arms were really strong, and here I am not being able to pick things up.
Yeah.
The frame of mind, I guess. But I am going to Doylestown, so I hope I get to see some of you out there. And thank you again, and God bless. Thank you.
Thanks,
Thanks, Grace. And that was I think that's a really great point to sort of wrap up tonight, Laura, just the reminder of, like, we're moving at our own pace. We are taking this, there's no, timeline to abide by. So really listening to your body. So I love that. I feel like we are all, I know I am incredibly relaxed and look forward to sort of working on some of those techniques in front of the TV this evening and just relaxing. So we appreciate you hanging on with us. I know we went over, we appreciate your time and knowledge, and hopefully everyone is taking all of this information with them. We will have all of the additional handouts for you. But like I said, I put that email to Healwell in the chat, and I will add that again. So please feel free to take advantage. But Laura, thank you so much for sharing your time and expertise with us.
Thank you to each one of you tonight. I really have been honored to be part of this wonderful group of people.
Thank you. All right. So what a wonderful speaker series we had. So as a reminder, this will be in Her library, likely tomorrow morning. Additional information will be available to you. We do have our second virtual hangout happening next Wednesday, the 11th, 5 p.m. Eastern time. We're jumping back in with Cassandra Bolding, who is part of the Black Lotus Counseling, just talking about anxiety, depression, mental health in the Black community. So we would love to have you join us next week. I want to give a big shout out to our sponsors, West Pharmaceutical, Daiichi Sankyo, Lilly, Merck, and GSK for always being supportive of having such wonderful events like this evening. So Lodi, I see you have a question. So if, we'll wrap up with your final question here. If you had a question, or maybe you're just waving. Good night. You're just waving. Okay, excellent.
She has her mute on.
Yeah, I asked to unmute. That's okay.
Lodi, just push the microphone that has an X through it.
I know it's never as easy as it should be, isn't it? I know. That's okay. Or you're welcome to put
Okay.
it in the chat. There we
Okay.
go.
Okay, it was very informative. Anyway, I suffer very badly with neuropathy in my hands and in my feet. I mean, it's unbearable. I just came back from a massage today with Christine, you know, your girl. So she's wonderful.
Good, good.
And this was
Yeah.
very informative too. And I'm going to follow up and see what else I
Wonderful.
could do.
Wonderful.
Thank you.
Like Laura said, yeah, it's just another tool in your toolbox to help you. So I love that, Lodi.
Thank you, Aaron. Thank you.
You're welcome. You're
Thanks for your
welcome.
work. And maybe I'll come and see you one day. I would like to
Oh,
maybe
we'd love that.
down the line. I would like to volunteer and do something, you know, give back.
Absolutely. Yep.
Okay.
We would love to have you.
Have a nice weekend.
You too. You too.
Thank
And
you.
thanks
Thank
everyone
you.
for hopping on with us. Yeah. Thanks for joining. Hopefully you took something with you. I'm sure we all did. And stay safe, stay healthy, and we will see you again very soon.